Hello, I'm Dr. Robert LaBelle. Today we're going to be covering core stabilization. Core stabilization is going to be for the shoulder blades in our first exercise, and then the rest of it will actually be aimed at stabilizing in the true core. So initially we're going to show an exercise called Quadra Pet. So I'll have Ariana go down into all fours. This exercise is going to be done for 12 repetitions at 3 sets, 2 to 3 times a week, similarly to our other strengthening exercises. There's some subtle nuances to this exercise that are key, and initially what she's going to do is she's going to push up through the shoulder blades here. So push up, very good. And what we don't want her to do is we don't want to round your back like a cat, so we don't want this. That's not what we're trying to achieve here. This is nice and flat through this whole process, and she just pushes up into here. As well, she brings her chin up and dorsally glides. This neck is not to go into any extension or flexion through the whole exercise. It's just the whole spine is straight as an arrow. Her arms and her knees are relatively shoulder width apart. So initially we're just going to raise one arm. So push up here, and you're going to raise your left hand slowly. And what you want to watch out for is we want this opposing shoulder blade to contract. So you really want to be pushing the heel of your right hand through the floor, keeping this contracted, and then slowly lower down. You'll be alternating through these exercises, lifting the left arm and then the right arm. So lift up the right arm. When she lifts up the right arm, the left shoulder blade has to contract. Good. The purpose of this exercise is to get the shoulder blade stabilizer strong, which will ultimately bring the shoulder blades back and keep your shoulder blades down. That deals with up here very well. The Quadruped is also a very useful exercise for dealing with lower core stabilization issues, and it's one we show a lot at the clinic. Same idea, your spine is straight as an arrow, but this time, as opposed to raising the arms, what we're going to do is we're going to raise one leg at a time. So push up here really well, Ariana, stabilize. Your core is nice and stabilized, and what you're going to do is you're going to bring this leg back and extend it. The purpose of this exercise is to keep this as level as possible and lower that back down, and then alternate legs. Lift up the right side. What we have a tendency to do is shift our body weight to the support leg. So we'll see that when Ariana does this, and this is something we all want to try and not do. So let's have you lift up the left leg. And her weight's been shifted a bit, and that's okay, a little bit of it, but what we really want to prevent is moving all the way over onto that side, just keeping it as neutral as possible. Lower this down. Good. The third exercise in Quadruped, which is an advanced exercise and something that would probably take a couple months of doing Quadruped before you could do, is lifting the opposite arm, opposite leg as you do this. So we'll go through this. Push up through here. Spine is straight as an arrow, and she's going to lift the left arm and as well the right leg at the same time. This involves quite a bit of stabilization. You can see that Ariana is shaking, and almost everybody would as they initially start doing this, and then lower down. Lifting the right leg and left arm, and then the left leg and the right arm equates to 1 repetition. She'll do that 12 times, take a break, 12 times, take a break. 3 sets of 12 reps. The next 2 exercises in our core stabilization are planks. We're going to go through front plank and side plank. So I'll have Ariana demonstrate the front plank initially. She's on her elbows, and what she's trying to do is keep this as level as a board as possible. Her abdomen has what we call a transverse abdominal hollow, meaning her belly button's pulled to the back of her spine, and that helps stabilize. We want to hold these for as long as we possibly can. An alternate to ease off on is to go onto your knees and just start like that. We'll do about 5 to 10 repetitions of these, holding for 10 seconds up into a minute. And that will be how we start. We can start on the knees, or if we're strong enough, we can go back up onto both feet. And an advanced procedure, once 10 repetitions holding for a minute is quite easy, is to lift up one leg, and then you really have to stabilize. Good. The last exercise is what we call a side plank, and this is to help strengthen the oblique muscles as well as the transversus abdominis muscles. Her knees are going to start a little bit bent, and she's going to push her body up into a straight line. You're going to want to make note that this is pushed back and this is all in a line, and that she doesn't have a sloppy bridge, that this is dropped down. You want this as level as possible, and she's holding a transverse abdominal hollow. Once again, holding for up to a minute. You can start at 10-second intervals, doing 5 to 10 of them a night. To make this easy, you can go onto the knees and just do a modified side plank, and that can help ease you into the process, making sure that this is all in line and this is up a bed. That is the core stabilization program that we typically show patients at CCSR. It's aimed at strengthening the entire abdominal and pelvic girdle, and the key during these exercises is to do them slowly and to recognize that if there's a lot of shaking, come out of the exercise, try modification, or ultimately take a break from it and go back to it the next day. We're not expecting your core to be built in one day. It typically takes a couple months to get a really good strong core.